Rebecca,
I
this is Josie, I was wondering if I could say something. My phone's about to die, but I have something to contribute along with Marcia, who I mentioned to you before, if that's all right. Doesn't die. So thank you for this intrusion a bit, which these are inconvenient challenges that women exist and marginalized people exist. And in theory, they might have rights in some cultural contexts. And that is sort of certainly the goal. With that lens of identity, I wanted to bring up that identity is very important, and we have to take into account the historic context that developed the initial seeds and roots of the United States-based social and healthcare system, which is foundation in fundamentally and systemically sexist assumptions about human development, as well as systemically vital, if not genocidal, approaches towards indigenous populations and towards Black people in particular here in the United States as a legacy of the systemic neglect of human rights that resulted from the systemic enslavement of individuals of color and a caste system that perpetuates in the United States social services to this day. From what I have been able to observe as a policy analyst within the occupational therapy profession, somebody who's invested heavily in understanding the history of occupational therapy and the social movements that gave rise to occupational therapy before the United States healthcare system, I just wanted to express that Medicare, which tends to be the default payer for both acute care hospitals and third-party reimbursement payers, I've seen multiple different Black and white text that substantiates that Medicare does not discriminate on the basis of diagnosis for access to services such as physical therapy, occupational therapy, speech therapy. Yet what I'm hearing from this call here and what I've observed as an acute care therapist and a post-acute care therapist is that discrimination on the basis of identity, by skin color, by sexual identity, by gender are active and aggressively maintained by our current contemporary healthcare system. And through definitions of triage, not only are our disabled brothers and sisters being systematically deprived of essential healthcare services and the bare minimum of standard of care, but even typically developing and fully functional adults and individuals that happen to have intersectional marginalization, whether it's by class, race, incarceration status, standing, and in particular, women of color, and in particular, Black women in the United States are currently subject to inhumane treatment as it relates to the reproductive system. This is something that I'm excited to partner with allies such as Rebecca Seagraves and those that are on this call. I'm here with Marcia Carter-Patterson. Marcia lost her son to systemic injustice and harm here in my local city of Tacoma, Washington, 3 months prior to the loss of George Floyd. And
it was during the same month, 3 weeks.
She's almost lost an additional grandson just in the last month due to medical negligence and access to standards of care of what we have discussed here, including manual use without gloves and refusal to take vitals at an emergency room setting. And we are working together to bring visibility to these causes. And I just wanted to add that to the conversation. You cannot understand contemporary triage and honestly, things that almost verge on maintaining systems of eugenics in the United States without taking into account the broader historic and socioeconomic context of the current profit-centered and care denial-centered aspects that are foundational to the US healthcare system. I do believe that therapists can and should play an active role in bringing visibility to these discriminatory practices and medical negligence that are systemic. They're not the faults of any individual clinician, but a part of a system that we all work in together. And our voices, I think, can be a power part of making sure that these marginalized populations are not alone in accessing the essential Medicare that they need, not just for pregnancy, but for every vital life life risk of fatality, we need to have equitable care. And my wish for this community is, if we start at the root, if we start at the pelvic floor, may every other systemic injustice have a pathway towards resolve. Thank you for including me on this community. I just wanted to add that broader context to the conversation and how important it is. Therapists have always been on the front lines of social justice causes and advocating especially for the disabled, which often pregnant women can be at risk for disability with these complications and their mental health, systemic mental health neglect. So I just want to honor and recognize that you're doing important work. While I haven't been in the pelvic health orbit, I'm a lifelong advocate for these communities. And I think that what is developed here can have great transformative potential to bring alignment of our healthcare system with many of our professional associations' stated values and concerns by diversity, equity, inclusion, and justice. Marcia, did you have anything you wanted to say?
I just wanted to really quick talk about my daughter that right now, she's experiencing pelvic health issues, and without occupational therapy or physical therapy, she's doing this all on her own, having a newborn baby and 6 other children and a husband that she has to provide and take care of. She had to go home from court today because she was in so much pain. So,
and this is also while she's navigating the potential of backlash with a nationally recognized trial for defending the loss of her brother's life. So I do know that we have consent to bring visibility to this causes formally with your daughter, and I am helping to be a point of care advocate to make sure that we can try to find access to the essential services for her recovery so that Marcia does not lose another child to the systemic. My phone is about to die, but I'm sorry, is there anything else you wanted to say?
No, that's all. No.
Marcia,
thank you all
if your service holds out, if you can say one thing to therapists who are encountering barriers to providing their services in the hospital to women like your daughter, or even knowing, I am so sorry about your son, but if there's something that you can say to change our minds about our role in this crisis, what would it be?
I mean, I heard that there's a therapist on every there's lung therapy, you get OT, you get PT, surgical therapy, OT, PT. How come there's not therapy on those pelvic interventions or those floors after childbirth? Why not? What's holding the systemic or the system back from bringing this therapy on to women that truly, not only Black women, but women that need this service? When you have a C-section, I had one. I didn't know what pelvic therapy or occupational therapy or physical therapy was. And I needed it because I was sick after that. My daughter was in the hospital for 3 weeks long. So it's needed. How do we go about bringing in knowledge, awareness? How are we going to get the needs met of these women that are going through C-sections and having these difficult births with occupational, physical therapy? I mean, particularly, I'm just going to say occupational because that's what we're addressing right now. But how are we going to? So that's my tone right now, and that is where I'm at. I want to see my daughter get occupational therapy right now, physical therapy right now, so she can start to feel better. Because you even address postpartum depression. Call it what it is. It's not somebody that's just going through because they just had a baby. It's postpartum depression. She's depressed. She has anxiety. All of the symptoms that you guys
not to mention the grief from the trial. Part of it too is your daughter is an inspiring civil rights activist, and she is somebody who's not held back in speaking truth to some of the most terrifying power holders in our community. So she's braced for backlash. That's one of the things I wanted to add to this conversation, that women of marginalized status and identities, when they show up and they advocate for themselves in these systems, they can be at risk for experiencing violence and backlash. And that's something that we need to be mindful of as healthcare advocates and licensed professionals, that we need to lie with our patients and not leave them alone when they're in a vulnerable position.
And that's where she's at right now. She's got 7 children. She has to make dinner for. She has to make breakfast for. She's traveling from Lacey to Tacoma every day for a trial. How come she can't have a Airbnb? Why aren't there
a village? Why isn't there a village?
Where are the activists and where are the people that are on our side? I mean,
it's not just for the loss of life that we've experienced from Black Americans subject to systemic harm. It's also about the lives that are not adequately supported.
And somebody else could have it. Another person can have it. But why can't we access the system in the same way that that white counterpart is accessing the system? Yes, it's about a racial. It's racial. It really is. Because it's a disparity.
If you can only access healthcare services through publicly subsidized programs, how really is Pelvic for healthcare going to be accessible?
And you're not going to get the best public health care that you can get if you're accessing it through a lower income status. And we know that.
And we know incarcerated women are just even more unlikely to access this level of care.
For the record, will you say your son's name?
Manuel, Manuel Ellis.
And Manny Ellis is kind of the one that they would search for on Google.
So you would go Manny and then Ellis, Manny Ellis.
There's a wonderful podcast documenting what our community has been going through in the wake of his unjust passing.
It's called The Why.
I'm so sorry for his story being lost in George Floyd, but I remember Manny Ellis.
Thank you.
Story.
I'm going to share in the chat before my phone dies an event that we're organizing together, and likely Rebecca, it sounds like she's going to help me prepare with Allison Sover, AOTA president, a statement of solidarity with Black women that are experiencing public health discrimination in acute care in a variety of different contexts. With your blessing, Rebecca, to share this. But we have a virtual event that will be accessible for folks that want to be part of this conversation and bringing these to light, especially through community art.
Thank you so much for both of your work. Thank you.
I will send the podcast in the chat as well. And just forgive me, it's going to cut out at any time, but thank you so much for this opportunity, Rebecca.
Thank you, Josie.